Lauren, I see a lot of percolation that as we open up society, we may quote unquote plateau in our statistics. Is that fear valid?
I think that fear is valid. I think the key is to open up safely. Exactly. Those words are so important, right? We still want to use all of those tools that we've been developing over the last year in fighting this pandemic. So when we're reopening businesses, can we do it safely with good practices about distancing between patrons? Can we continue to use masks? Can we continue to reinforce those face covering requirements, even if we're reopening bars, restaurants, other businesses in society, and especially in schools?
Yesterday, Mayor de Blasio of New York City came out and said it's really unfortunate that cities aren't receiving vaccines directly from the federal government, that it has to go through the state. Yes, this has to do with the tiff between Andrew Cuomo and Mayor de Blasio, and yet this also does highlight a key question. Should cities be getting the vaccine directly? Should we be getting a better distribution mechanism from the federal government?
Yeah, I think this is a challenge, not just with the vaccine distribution. We saw it with testing. We've seen it with a lot of the other healthcare activities associated with this pandemic and healthcare more broadly in the U.S. We do not have a federal system for healthcare. We have a disaggregated healthcare system. It makes national strategies for anything really challenging. And we're seeing that play out in real time. And it'll only be exacerbated in an emergency, right? Because you have to make rapid decisions. You have to rapidly distribute. But you still have to use these existing chains, these existing pipelines. And so if you want to get vaccine into the hands of the community that has the greatest need and can and knows how to work with that community to access them, absolutely go through these processes. But the way our healthcare system is set up, there are these sort of chains and pipelines that slow things down.
Lauren, let's talk about slowing things down right now. The president says May 1st to open up eligibility to all adults. Here's what Montana's got to say April 1st. Ohio, similar story, end of the month. Every other state that watches this happen, and I can tell you living here in New York, when I look to Montana at the end of the month and Ohio and start to see eligibility wide open for 16 plus, I'm going to be asking the governor here in New York the same thing everybody will be asking. Why can't we do the same thing? What is going on? What is stopping places like New York and others just to do the same thing now, open up eligibility?
Yeah, I think there's a couple challenges, right? So part of it is the access. How do you make sure that you're getting to those most vulnerable communities? And that goes back to what we were just talking about. Do these states that are moving up that timeline, do they know how to access their vulnerable populations quicker? Or are they just moving on because they have sort of not been able to access those communities and they want to get vaccine more broadly? These disparate decisions about how we administer vaccine and how we interpret the ACIP guidelines are what's leading to these changing dates depending on where you are. So it also can lead to sort of vaccine shopping, which I think we're seeing a little bit in places, especially in more well-to-do places where people have better access because they have multiple residencies or they meet requirements in one area and not in another, and they can relocate to access those vaccines. So I think that May 1st deadline or timeline it's exciting and it's reasonable, and I think we can get there, but we really have to focus on making sure that in communities where access is hard or where we're not getting at those most vulnerable, hard to reach communities and populations, that's where we target to make sure that we are protecting those who need that safety net so much more.
Lauren, in some ways, these are details, especially when you look at the scene in Europe, where they're struggling to get even a relatively significant portion of the population vaccinated. Angela Merkel's advisor said today that the biggest economic risk is a third wave of the virus. In the United States, based on the vaccination schedule and that May 1st pledge, is the threat of a third wave off the table?
I wouldn't say it's off the table. I think we are definitely in a better place, and some would say we're in a much better place than we thought we would be, and especially as we started seeing the B.1.1.7 variant enter into the U.S. We're still seeing increase in cases in that variant, and I think there's a lot of questions about what will happen in the numbers as these rapid reopenings change in places like Texas, for example. But right now, the numbers are still looking good, and I think the key is to hold on to those measures that we have worked so hard to implement that we know work as we expand vaccination coverage. We're doing a great job, I think, in getting the numbers of vaccinees up. And now the key is to do those targeted areas that have lower vaccination rates to keep those overall numbers across the country down.